So we're going to go through some neurodynamic testing for the median, ulnar, and radial nerve. It's important to make sure we do is that we test it the same way every time because we're putting tension on the nerve. So if you have a way that you like to do it, just make sure you're doing it the same way every time. The way we're going to present it today is the way that's kind of standardized that was taught to us by Evidence in Motion, but if you have a way that you like, just make sure you're doing it the same way every time. So with all of our upper limb tension tests, we're going to consider it a positive test if it reproduces symptoms, if there's more than a 10-degree difference side to side with the sensitizing motion, or if cervical side bending towards or away changes the symptoms, because that kind of lets us know that there's some cervical involvement. So first we're going to do an upper limb tension test for the median nerve. We're going to start with scapular depression. You don't need to push down too hard. You can just kind of post your hand here to make sure that we're making sure that the scapula doesn't ride up. Then we're going to combine that with some shoulder abduction, forearm supination, wrist and finger extension. Like to get around here and make sure we're keeping the thumb extended too, to make sure we're tensioning that recurrent branch of the median nerve. We're going to do external rotation of the shoulder and then elbow extension. So we're going to go until the patient feels the reproduction of the symptoms. To kind of rule in cervical involvement here, we'll ask them to side bend towards that side, see if that changes symptoms. If it doesn't, then we can side bend away, see if we change symptoms there, right? The next one we can go through is for the ulnar nerve. So we're going to start with our scapular depression here. We're going to start with elbow extension, and then forearm pronation, wrist and finger extension, and then we're going to come up to elbow flexion. That's our sensitizing motion here. So with this, you want to make sure you're keeping the lateral two fingers, or the most medial two fingers, fully extended. And then again, if we feel symptoms, we can side bend towards or away and see if that changes symptoms. Last one we'll do is radial nerve. So we're going to, again, depress the scapula, bring them down here. They're going to be an internal rotation. You're going to have them make a fist with their thumb on the inside here. We're going to do forearm pronation, wrist and finger flexion. And then our sensitizing motion is into abduction. So we're going to make sure that they keep their elbow extended here. Sometimes the patients want to flex their elbow. And again, once we feel symptoms, we can side bend towards, see if that changes symptoms, or side bend away. And again, you want to compare to the other side. If there's more than a 10-degree difference, that's considered a positive test.